In this video, I answer a question on why doing corrective exercises to help reduce neck pain is actually making the problem worse. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This results in a significant increase in flexibility, function, and long-lasting pain relief. All right, so this question came from Steph on Instagram. The question was, with my job, I have to spend at least 7 to 8 hours per day working on my computer or my phone, which has started to jack up my neck. I watched some videos online about the importance of correcting my posture to help reduce the pain, but every time I do them, it makes the pain worse. I've been doing them every day for the past month, and I'm not sure if I'm doing them wrong or if something else is going on. Thanks so much for that question. And just a quick reminder, if you have any questions or looking for answers specifically on neck, shoulder, low back, or hip pain, then send a message to me. And if I think my insights can help, I'll be sure to get a video out to you. All the information to do that is in our profile or wherever you're consuming this video. All right. So first off, why are the exercises hurting? In the most basic standpoint is the tissue and the muscles just aren't healthy, and trying to exercise them when they're not healthy is like the equivalent of like trying to fix a cavity by brushing and flossing. It's going to really irritate that area. So first thing is we want to talk about is like, how did this problem actually happen in the first place? And the first thing that forms is this stuff called adhesion, also known as scar tissue. So a lot of times people are like, well, how did I get scar tissue or adhesion? I never had an actual injury. It's actually way more common, especially in modern society where people like Steph are just on their computer, on their phone all day long, looking down, stretching those muscles out. When they don't get enough, when they're constantly stretched, they don't get enough blood flow. They don't get enough oxygen. So the body actually thinks eventually that there's an injury there. So it starts to lay down this stuff called adhesion. It's like these collagen fibers that haven't been fully cooked yet. They get inside the muscle. And first thing is they make them less flexible, and then they make them weaker. And eventually they get stuck to the nerves and cause all sorts of problems and dysfunction in the area. So a lot of times people think, oh, my neck is tight, I just need to stretch more. That's not the case. Or they say, oh, it's weak, I need to strengthen it. We go to these very simplistic ideas of it's tight, stretch it. It's weak, strengthen it. But we have to ask and answer the question of why is it tight? Why is it weak? And it's because that adhesion is building up over and over again. So why isn't it getting any better? It's the same thing I just said before. It's like, think of the adhesion getting stuck to the muscles and nerves as like a cavity that needs to be precisely treated, precisely drilled out, and getting that out of there. All those other things like stretching exercises like brushing and flossing. Imagine if you had a big nasty cavity in your tooth and you're jamming on it with a toothbrush and trying to floss it out of there. It's going to hurt. And this is what's happening in this issue and why it's not getting any better. So what do you do to get long lasting pain relief, and not feel like you're doing these exercises that are only making things worse? First thing you need to do is you need to get focused treatment by an adhesion expert to get rid of the adhesion. A lot of people think that it's very similar to like a basic massage or something like that, but adhesion treatment experts that are trained in my method called the peak method are able to get in there very precise, very focused, and get just the right amount of depth, just the right amount of tension to actually break that adhesion down and get it out of there. And almost like kind of like be the dentist that's going to drill the bad cavity out. Next is just be mindful of the device use and workstation setup. If you're finding yourself, 6-7 hours in and you're just looking down all day long, just set a timer for 5 minutes and go take a walk, be a normal human, take some breaks and stuff like that. Or when you do get home after being on the computer all day, just don't be on your phone even more. Just, be a normal human, go for a walk and spend some time doing that. Now, once the adhesion is actually removed and things are functioning and moving better, then those corrective exercises are great. They're going to keep things in a good place. I say the adhesion treatment on the front end is like getting the cavity drilled. And then the corrective exercises when the tissue's healthy is like brushing and flossing and making sure that everything stays healthy and the cavity doesn't come back. So that's all I got in the video. if you're struggling with all this, you're having neck pain, you're doing never ending exercises, getting massages, getting adjustments, and nothing seems to work, then click the profile link and learn more about our specialized chronic neck pain treatments. And you can also request a no charge injury consultation with one of our dedicated providers and get on the path to feeling and functioning a heck of a lot better. I appreciate you watching the video, and I'll catch you on the next one. Bye.